Hi, I'm Desmond Slattery from Nirvana Ergonomics, the educational arm of Nirvana Massage Tables. Welcome to Peak Positioning. It is generally accepted in our business that the common goal of massage and bodywork, whether in a spa, clinic, or medical setting, is stress reduction and relaxation. How best to achieve this? With peak positioning. What is peak positioning? Peak means the top, the ultimate, and the best. Peak positioning means positioning and supporting your client on the treatment table with the goal of reducing musculoskeletal tension before your usual treatment protocol begins. We are certain that after you learn these techniques, you will view this process as an essential part of your treatment, where you can make observations, connect with your client, and begin the relaxation process. You can think of the time you spend on peak positioning as a mini treatment. As you begin to practice and experience these techniques, we are sure you will agree. Applying peak positioning is a first step toward optimal treatment results. The benefits of peak positioning are better ergonomics for the client and the practitioner, enhanced relaxation and body awareness for the client, and shorter treatment time to achieve goals. Correctly applied, peak positioning will have a positive effect on your treatment outcome. Conversely, incorrect positioning will have a negative effect. To make an everyday comparison, if we drive a car in a poorly designed seat or sleep or nap in an awkward position, we will end up with muscle tension or some sort of pain. Now picture the massage table. Here we have the additional factor of force applied by the massage therapist to the client. Force will only add to the negative effects of poor positioning. For example, if we have not properly bolstered the knee in supine position and we apply pressure, the client will experience pain or possibly hyperextension of the knee. Now you begin to see how important peak positioning is. Remember, peak positioning is the beginning of your treatment. Applying peak positioning means using your observational and palpation skills to identify areas of tension or holding which require peak support. This process will also aid in helping your clients become more aware of their own tendency to hold or maintain positions which create more tension. Most clients experience this as a time of relaxation and connection. Clients feel more secure when they are positioned for optimal support. Most clients experience this as a time of relaxation and connection. Clients feel more secure when they are positioned for optimal support. We will be demonstrating peak positioning for 4 treatment positions on the table: supine, side position, 3/4 prone, which may be new to some of you, but which is a very effective way to work, and prone position. In each position, we will show you the best way to align and support the receiver on the treatment table. Gravity, combined with peak positioning, will begin the relaxation process before the actual treatment even begins. When treatment pressure and strokes are applied, all of the energy will go into productive work rather than trying to overcome resistance or strain caused by the lack of proper support. Before we begin, we need to brush up on our postural analysis and observational skills. The more insight and information you have about your client, the more tools at your disposal for great treatment outcomes. Now, let's talk a bit about postural analysis and using your observational skills. As we explore posture and key anatomy, please keep this very important point in mind. We are not trying to fix anything or force anything. We are simply observing so we can apply peak positioning with all the information we've collected. And now we're going to talk about some common postural variations. A great place to start is at the feet. The actual anatomy of the human foot is an architectural marvel. To remind you of some basic foot anatomy, there are 26 bones, many articulating joints, and over 100 muscles, ligaments, and tendons. There are 3 arches, 2 longitudinal and 1 transverse. Detailed exploration of this is beyond the scope of this course, but I do encourage those who are interested to pursue further study. For our peak positioning purposes, we want to sharpen our observational skills relating to the position, tracking, and symmetry of the feet. Then we can use this information to correctly position our clients. First, let's talk about foot posture. Take a look at this video clip. There are two main foot positions which affect posture and gait. They are pronation, or the rolling in of the feet relative to the legs, and supination, the outward rolling. Next, we want to look at the tracking of the feet, either the out-toeing or in-toeing, otherwise known as pigeon-toed or duck-footed. Also, we want to look at the symmetry of the feet, where you may observe differences in variations in each foot. As a reminder, we are just observing, not judging, analyzing, or fixing. These observations will help us achieve peak positioning on the table and maximum comfort for your client. There are many factors that determine and affect posture. Ideally, we want a functional posture that allows freedom of movement, not an ideal or a forced rigid posture. Now, let's take a look at this video again and see if we can spot some of the variations. Now, let's move on to the rest of the body. We're going to discuss overall body posture. Moving up to the pelvis, here are some of the postural variations you may come across. Anterior pelvic tilt. An anterior pelvic tilt occurs when the pelvis rotates forward. The tilted position increases the natural curve of the lumbar spine. Posterior pelvic tilt, or a flat back, reduces the lumbar curvature. Lateral pelvic tilt, where one side is higher than the other. Pelvic rotation, where we can have forward or backward rotation relative to the spine, and then left-right symmetry differences. Now we want to teach you about the back as a whole and about several common spinal alignment and postural variations. Scoliosis, which is a lateral toward the side curvature in a normally straight vertical line of the spine. Lumbar lordosis, which is an excessive inward curve of the lumbar spine. Flat back syndrome, which is just the opposite. And thoracic kyphosis, which is an excessive outward curve of the thoracic spine. Moving up to the shoulder and neck region, we find variations such as rounded shoulders, tight elevated shoulders, forward head, and flat cervical spine, which is a reduction in the natural curve of the cervical spine. Postural observation will start to become second nature to you now. When you're out shopping, on the street, or in the park, take a look and become aware of all the variations of posture, noting the connection between function and movement. A great place to start to make the connection between posture and function is by observing professional athletes. Now we are ready to apply what we've learned so far. And remember, we're not fixing anything, we are simply accommodating for the different postural variations you will come across. This concludes the theory portion of the class, and now we're ready to get to the practical applications. We are going to begin in supine position.